Greetings and welcome to another episode of Doctors In. Today we have Dr. Bobby K. Mathew from NMC Specialty Medical Center, Rola, Sharjah. Let's hear it from the doctor himself. Welcome, doctor, to the show.
Thank you.
So, doctor, would you like to introduce yourself and speak about your field of specialty?
Yeah. My name is Dr. Bobby K. Mathew. I've been working as an endocrinologist both in Ernakulam, that is in Kerala, and in UAE. So, my field of specialty is endocrinology, that is hormone. So, naturally the degree is MBBS, MD General Medicine, and DM in endocrinology. MBBS, MD I did in Government Medical College Trivandrum, DM endocrinology from KEM Bombay. So, I've been practicing in Ernakulam and UAE after 2006. From 2006 to 2010, I was practicing in Ernakulam alone. From 2010 to now date, I am working 15 days in Kerala, 15 days here in NMC Rola, Sharjah. And our specialty is endocrinology, means core of hormone. But usually you tell about hormone, people know about two hormone disorders. One is diabetes, second is thyroid. We know invariably India, China is the world capital of diabetes. We almost know almost 200 countries, but you take 5 people walking on the road in there or Dubai, wherever, with diabetes, 2 out of them is one is an Indian, one is a Chinese. So India and China, in spite of not having that much obesity, we have genetically high risk of diabetes. And thyroid disorders are also very common. You know, 1 in 10 ladies is thought to have hypo or hyperthyroidism, and men also thyroid is getting more common. So invariably, you ask about hormone disorder, people tell it is either diabetes or thyroid, but there are hidden hormones. What are the other hormone glands in the body? We know we have our heart, gut, kidney, lungs, everything. Heart has a weight of around 500 gram, kidney has a weight of 1.2 gram, and the liver has a weight of 1.2 kilogram. But when we study for even 10th standard or pre-degree, we know which organ is known as the master gland of the body. It's a small gland situated in the head behind the brain, that is known as pituitary. Pituitary is known as the master gland of the body because it controls the whole of the body functions. So you can ask me, doctor, why come pituitary? Why can't heart be called as the master gland of the body? Because pituitary produces 5 hormones. Number 1, for the height, that hormone is known as growth hormone. Suppose a child is very short, we tell that he's dwarf, he's not growing at all. We know the hormone for height is growth hormone.
Right.
Some people are very tall, you tell, oh, he has a height of 150 or 180 centimeter. So invariably, you know, it's tall stature, that growth hormone is high. When a child is born itself, you know, a boy is born with 2 testicles and a penis. A girl is born with a uterus and ovary. But girl becomes a female with a menses starting by the age of 13 years. A boy has a mustache, sexual development from the age of 14 years.
Right.
So that is also controlled by the pituitary. That hormone which controls the sexual development in a male and female is FSH-LH. And we know about thyroid. When we check thyroid, we check the hormone TSH. But the TSH from the thyroid conduction is controlled by the pituitary, so TSH. So pituitary, 5 hormone, first and foremost is the growth hormone. A guy or a girl with a good height, she has a good confidence, or he has a good confidence, that is height. Sexuality, if a boy doesn't have a good penile length, good mustache or a good masculinity, he goes to the gym and works out, still he doesn't have a muscle, you know the testosterone is coming down. A female has her menses but no breast development, no femininity, you know the female hormone is coming down. That is controlled by the pituitary. And thyroid, we know, controls the intellectual capacity, your brain and your other metabolic function. If you don't have thyroid, that is also controlled by the pituitary. And we know some people have body weight, some people eat half chapati, they gain weight. Some people eat 25 chapati, they don't have weight.
Right.
So the weight is controlled by the hormone of cortisol. That is also controlled by the pituitary. And when a girl becomes a mother, she has to lactate. So the milk has to come. That hormone is known as prolactin. That is also controlled by the pituitary.
Right.
So we have diabetes, thyroid, but invariably hormone disorder, pituitary is considered as the classical gland or the master gland of the body. And I told you, thyroid is there in the neck, but 2 small glands near the thyroid, that is known as parathyroid. That controls the calcium in the body.
Right.
Now we hear so much about vitamin D. People going to the sunlight, getting vitamin D. During Corona also we have heard that you have vitamin D, you have a good immunity. So that thyroid and parathyroid, invariably behind the thyroid, always controls the calcium metabolism. And pancreas, small gland in the abdomen, it produces insulin. And you have kidney. Kidney is a big organ. Above the kidney is a small gland that is known as adrenal. So adrenal can produce cortisol as well as male hormone. Right. So that is why some females come to us and tell, Dr. Bobby, I am having excessive hair in the body. Actually, a female should have hair in only 2 areas. One is in the axilla, pubic area. Suppose a female has hair in the upper lip, chin, chest, abdomen, thighs. Suppose she is shaving. At the age of 18 years, a lady is having hair growth. She is shaving, it is not coming back. Okay, it can be considered as an occasional thing. Suppose a lady comes and says, no doctor, I am having hair growth right from the age of 16 years. I have been removing it once in a month. Nowadays, every 2 days I have to remove. That means that her hair is increasing. That means that her testosterone or male hormone is high. In a female, the male hormone is produced from the ovary or the adrenal gland.
Right.
And male, you have the testicles, the balls that is sitting there. And many of the males actually don't have an awareness about the sexual problem. That's why guys, when I come to here, even now I'm here for 3 weeks, guys come with so much sexual problem. They come with erectile dysfunction, infertility, even alopecia, hair falling like
hair
anything,
loss,
the muscle mass. Some people go to gym. Nowadays, TikTok and all are very common. People go to gym and work out like anything. 5 friends are going, 3 have a good 6-pack, 2 doesn't have. Then they get depressed and then they come and ask us, doctor, shall I take some hormone to increase the muscle mass. Because females always have a wonderful thing that's known as a menstrual cycle.
Right.
A lady bleeds every month. Suppose a lady doesn't bleed for 3 months, her breast is increasing, coming down, or bleeding size is, bleeding blood is more or less, she goes to a gynecologist. Gynecologist check her hormone, thyroid, everything, but men don't know what to check, which
Right.
doctor to go. Many people come with infertility and sexual problem after marriage. When the wife complains of sexual dysfunction, or the wife, when he unbuttons his shirt, suppose he has a gynecomastia, then the wife tells, then the guy comes to us.
Right.
That's whenever we go for interview, people ask for diabetes, thyroid. I tell, okay, diabetes, thyroid is there. India, China is the world capital of diabetes. More people nowadays, they have heart attack due to diabetes per se, but other hormones should be always not mistaken, and that should be made more clear to the people.
And what are the symptoms in male hormonal imbalances?
Yeah, actually the hormonal imbalance may have symptoms, may not have symptoms. Females definitely have symptoms. Females have symptoms most commonly of menstrual irregularity.
Right.
A female bleeds in a month, she doesn't bleed in 3 months, okay, irregular. Suppose her breast size comes down, you know, she is entering menopause, estrogen is coming down. Breast size is increasing. She knows that probably she is getting fatter or estrogen is increasing.
Right.
Even hair loss. A female having 10 hair loss, let it be a 10-year-old female, let it be a 60-year-old menopausal lady, a retired, whatever officer coming. She lose 10 hair, she go to a dermatologist, at least for this thing. We
Right.
see men going with full baldness, telling
Right,
that I am a
right.
male pattern baldness. All the film stars are bald. They never bother about hair. Because that is why females are concerned more about their hormone compared to men. And female disorders are more picked up by gynecologists than men per se. That is why it is told that a female enters pregnancy. Suppose a lady goes and gets pregnant at the age of 25 years. The gynecologist first will check her blood group. She will do an ultrasound abdomen for the uterus ovary. She will check her thyroid function. She will check her BP. She will check her ECG. She will check her thyroid and blood sugar. So almost everything is done.
Right.
How frequently does a guy go and check his thyroid? How frequently does a guy does the ultrasound abdomen? How frequently does a guy check his sugar or ECG or any changes? That is why 1 week back, Siddharth Shukla was a big boss star, big macro star, six-pack muscle. One fine evening, he's dying, mother, he's asking for chest pain, one sip of water, collapsing and dying. So 3 days back, we heard another guy in whatever Kerala, going for shuttle badminton, sitting in the, we all said in the WhatsApp me, sitting in the chair and looking, after 5 minutes, collapsing of a heart attack. So you ask me, my age is 43 or 44 years, I've been working in this country just for 10 years, or you people have been working say 5 or 10 years. You ask me, Dr. Bobby, have you ever heard any lady dying in this country of heart attack less than 50 years? No. For the past 10 years or past 15 years, I have never seen, or you people would have never heard a lady less than 50 years dying of a heart attack. But every day you see at these guys, 35, 40 years, collapsing, dying.
Right.
Yesterday also, a guy driving car, parking somewhere, silent heart attack. Because why? We know females are fatter than men. Men are thin, but females are fatter.
Right.
But females have a heart attack after menopause. Their ovary protects a female, but testosterone never protects a guy. That's why many husbands come and tell, doctor, my wife is very fat. She didn't have a heart attack. I had a heart attack. Because wife is a female. She has estrogen to protect them. Men don't have testosterone to protect them.
Right.
That is why even men with baldness are thought to have a high testosterone. Their chance of heart attack is much more higher. And we never hear a female complaining of sexual dysfunction. We hear a female is not interested in sex, but we never tell that she is having sexual dysfunction. But we hear men having sexual dysfunction, men having low libido, no erection, premature ejaculation. So all the problems are actually much more common in men compared to females. But females address it much more earlier, men doesn't address it.
Right.
And what are the symptoms of hormone disorder in men? It can vary. It can vary from decreased libido, that is decreased sexual drive, due to decreased muscle mass, or a gynecomastia. You go and remove your shirt, your breast is popping out just like a girl. That is also a male sexual dysfunction. They can have baldness, they can have increased muscle mass in the body. Some people have increased fat mass in the body. So that's why I tell anyone, any guy at the age of 25 years, you think that your body is not proper, you think that your penis is not good, you think that your muscle is not good, you think that you're shaving but hair is not coming that good, you think that you're going to the gym, your muscle is not building, go to an endocrinologist, go to uro, just check the male hormone, that is testosterone. In this country also testosterone is covered by insurance. Normal testosterone should be more than 3.5. If your testosterone is less than 3.5 testosterone, you can have any form of testosterone. You have to take a testosterone injection, you can have testosterone gel that is available, testosterone capsule. You go to gym anywhere here, you have testo boosters. You go to, day for yesterday I went to Discovery Gardens, where one gym I was going, I was seeing all the testo boosters and supplements. So it is not boosters. If your testosterone is low, you can very well take testosterone.
Right.
In this country, everything goes through guidelines. In India, you can just like a testosterone, you can go to a medical shop, go to a casualty and take them. No. In this country, you have to take through ministry, but the testosterone less than 3.5, you can take that. Just like that, a female having low estrogen, she can take the sex hormone also. That's why whenever I go, males always have that discomfort of a inferiority complex also when their testosterone libido is low.
So what are the available treatments for this?
Yeah. Always hormones, the treatment is depending upon the deficiency. Just think of diabetes. If you have a child of 10 years having diabetes, no insulin, you can give insulin from outside. If you have a lady of the age 10 years or girl of the age 10 or 15 years coming with hypothyroidism, you can give thyroxine. So it's always hormone replacement therapy, HRT.
Okay.
Suppose a boy at the age of 15 or 25 is not having testosterone up to the 3 to 10 nanogram, he can take a testosterone injection, capsule or cream and finish it. Just like that, if your body is not having cortisol, you can take that. But hormones, many people come and say, ask, doctor, is there any side effect for hormone? Hormone side effect occurs when you are supplementing that.
Okay.
Suppose your body is having testosterone, but a guy is thinking, coming and telling me, Dr. Bobby, I have a movie shoot. After 3 months, I have to have a good muscle. My colleagues have a good muscle. I have to take testosterone to build my muscle. Then it is a supplementation. It's not replacement.
Okay.
Replacement is that your body is not having testosterone, I am giving you. But the other thing is that I am having testosterone, but I am again supplementing it for augmentation. That has side effect. Just like that growth hormone, we know the most important hormone for height is growth hormone. But growth hormone maximally is abused as a doping agent for muscle building. Because growth hormone is the hormone which cannot be given in urine test. You take a testosterone and go for a sport, you check the urine, you can doping, you can check the testosterone, but growth hormone cannot be checked. So that is why basic principle people tell is there side effect with hormone. If you are not having hormone, you take it, there is no side effect, there is effect only. If your body is having hormone, you are extra taking it, then you may have side effect. That is why many of the people who go to gym for workout who are having testosterone, once they stop that, they are feeling tired, exhausted. Many times their sperm count also comes down. So basically, if you have any doubt about hormone, go to an endocrinologist, not me, go to any doctor. Just you pay the consultation fees, just get clarified with this thing, then only take all the supplements and boosters.
Right. And what do you say are the precautions to avoid such situations?
Yeah, there is nothing precaution. Only hormone disorder that can be prevented is probably diabetes mellitus through obesity. We know India, China, I told you, is the world capital of diabetes. Now, Indian study have shown that up to 20% of Indians, that is, you go to Trivandrum or you go to any Sharjah junction, Rola junction, or you go to Ernakulam, stand on the road and take 10 guys or females walking on the road between 20 to 60 years. So 20 and 60, you are randomly calling 10 people and checking the blood sugar. 2 or 3 out of 10 is thought to have diabetes or pre-diabetes. That is, India, China is on the verge of bombarding with diabetes mellitus and associated complications. But diabetes has no symptom. How do you know that I am having diabetes? If I check my blood only, you know I am having diabetes.
Yeah.
Diabetes causes symptoms when sugar is 300 or 400 when you have thirst and urination. That is why now it is screening for diabetes, just like PCR. Previously, we were just checking people with symptoms. Now we know you are coming to airport, going to airport. In Kerala also, you go to a shop and just randomly checking. You are screening. So you screen for diabetes, you get more people. And you ask me which is the biggest risk factor for diabetes. Most biggest risk factor or the biggest risk factor is a family history. Father, mother having diabetes, your chance is 50%. Both parents, father, mother, both having diabetes, chance is 75%. Father, mother, brother or sister having diabetes is 90%. So you can reduce your weight. Suppose a guy is having a height of 175, weight is 85. So the optimal weight for the height should be 175 minus 175. From 85 he can reduce to 75. But still he is having diabetes, you know, it is not the weight, it is the family history that is causing diabetes. But Indians are always having a problem. They are more hesitant to take tablets or medicine till they have a complication. Even what happened to vaccination, vaccine was available in that country, we know from November or December. But 50% of vaccine slots were empty. In Kerala and all, my hospital and all, 50 slots are there, 20 people used to go. Other people, I will not take vaccine, I will take homeo medicine, I will take immune boosters, vitamin C. Once the second wave came and people started dying off, they rushed to the hospital for vaccine. That happens in every medicine. A person comes with a sugar of 500, you ask to take insulin, no doctor, I don't want insulin, I will go for alternative medicine. A patient comes with cholesterol, you ask for cholesterol, a cholesterol tablet, I don't want now, I'll take it later, I'll take herbal medicine. So they take later, they have a heart attack, kidney failure, then they take all the medicines. So the basic principle is you are having symptoms for few disease. You are having fever, you have symptom. You have a white patch, you may do a plastic surgery. Suppose you are talking to someone, you are having a bad smelling mouth, you will go and spend thousands for that. But diabetes, cholesterol, BP have no symptoms. But the symptoms of disease actually cause a heart attack, kidney failure, stroke. But men fall the prey for that. Men suffer much more compared to female. That's why I always say silent killer is sugar, BP, cholesterol. Last year people were telling that about 114 people here died, Mallus or Kerala, died of nothing but corona. But almost 200 guys in these GCC countries die of coronary artery disease, that is heart attack. That is, more people are dying of coronary than corona. Corona may kill few, but more people per day you check heart attack, heart attack, heart attack. GCC countries you have, previously it was 60 years, now 35 years, yesterday 28 years. Young guys dying. But these people could have prevented it.
Right.
Because day before yesterday I saw a guy with angioplasty. He was telling the doctor, my brother had a heart attack at 35. I didn't know that, doctor. I had a chest pain, I went an angioplasty. If the brother had a heart attack, his father had a heart attack at 48 years and died. Brother had it at 32, he went an angioplasty. This guy is 28 years. That means that there's a family history of heart disease, family history of cholesterol. In addition, he's a smoker. So heart attack occurring at age of 28 years.
So it's hereditary.
So, yeah, hereditary, but hereditary may be modifiable factors and non-modifiable. Modifiable is smoking, but genes he can't modify.
Right.
But he could have gone for a screening for heart attack with an ECG or a TMD. That's why I always say prevention is always better than a cure. Men always succumb to heart disease and kidney failure much more earlier. So always check it. That's known as a health checkup. Health checkup is nowadays just like servicing your vehicle. You have a new vehicle, BMW or even a Maruti Alto you buy, every 5,000 kilometers you service it.
Right.
That's why every guy about 25 years, once in 6 months, you go to any hospital, check your sugar, check your cholesterol, check your liver, check your kidney, uric acid, vitamin. It costs you 500 rupees. Here in insurance, everything is covered. But people don't check up. People just go for fever, other thing, allergy. They don't go for a regular checkup. We think that we are going to live till 50 or 60. We don't know whether next hour we are going to live. We may die of a car accident, but we should not die of a heart accident or a heart attack. That's the only thing that is preventable. Because if we walk carefully also, another person can bump and finish us. But if we live carefully with a sugar, BP, cholesterol and no smoking, we can live. And smoking is thought to be the second biggest risk factor for heart attack. First is cholesterol, second is smoking, third is hypertension, fourth one is blood sugar.
Right.
Even if blood sugar has to cause a heart attack, you should be a smoker or cholesterol should be high.
Okay, and in terms of outcomes of hormonal imbalances, along with that, what are the most effective ways to control hormonal imbalances?
Actually, I told you. Thyroid, look at thyroid. Previously, we know thyroid was thought to be iodine deficiency.
Right.
Now you ask anyone, thyroid has nothing to do with diet because India is totally iodized after 1984. You take any salt on the earth, which we take in India, it is all iodized salt. Tata, Namak, Captain Cook, you go to Luluma, Nesto, Carrefour, Spinach, everything iodized salt. So thyroid is not due to antibodies. Antibodies stimulating the thyroid, causing hyper, destroying the thyroid hypo. So the diet and thyroid is totally out. What about diet and sugar? There is inevitably 80% connection between diet and sugar. That is why many people go for a crash diet, keto diet and tell my sugar has totally disappeared. Because you have a carbohydrate deprived diet, high protein diet with an exercise, your sugar can go down. But what does US diet recommend say now? Your cholesterol you have no control with your diet. That is why US diet recommend says that you take red meat, egg yolk, fried roast item. Nothing is going to happen to your cholesterol, but you exercise properly. Still your cholesterol is high, take the tablet for cholesterol that is statin. Because cholesterol 10% is controlled by the food, 85% is produced by the liver and the fatty liver. But sugar, no. It is what you take that controls your sugar. That is why many people take tablet for sugar. They don't take for cholesterol. That is why all the big boss stars, all the people die off. They think that I am working out in the gym for 3 hours. I am going for treadmill for 2 hours. Why should I take cholesterol? I am pure vegetarian. I drink everything veg and I am a pure vegan. But think that your sugar can be controlled by your diet. Your cholesterol, you can't do anything. Your diet controls, suppose you take that egg is harmful. Egg contains 300 milligram of cholesterol. Suppose a person takes 10 egg per day also, that contributes to bad cholesterol by 10%. So that's why I always tell you, females, your heart is protected by estrogen. Men, your heart is not protected by testosterone. So always respect the values, always go for it.
Right. Doctor, let's take the topic of hair loss.
Yeah.
What would you say about hair loss as the symptoms or side effects of hormonal imbalance?
Okay. Hair loss theoretically is known as alopecia. You have a person with hair loss. What does he or she used to in the past? In Kerala or India, people tell her, no doctor, I have changed the country. When I was in Kerala, my hair was full. When I am changed to UAE, my water is not good, so my hair is falling. Some people know my mother will cook oil and send me that oil with all the herbals. If I use that, my hair will grow. Now we know alopecia has nothing to do with all the herbal oils, whatever food you take. Whenever you have hair loss, you have only 4 causes. Number 1 is a dandruff causing hair loss. That is known as tinea capitis. That usually occurs in puberty. 15 to 25 years you have dandruff, but dandruff never causes baldness. Your hair will fall, it will regrow like that. So you use whatever oil, you use a shampoo, antifungal, ketone and selsun, that will go. So most common cause of baldness in male is not dandruff, it is not vitamin deficiency. It is male pattern baldness. You look at the superstar Rajinikanth, once he he's not acting in movie, he never wears any wig. His baldness is like this. He has hair in the occipital area. Look at Narendra Modi, our Prime Minister also. He never wears anything, but invariably hair is receding. Here, this part they have hair. So whenever men lose hair, it's an androgenic alopecia. It is known as male pattern baldness. Such men have actually high amount of testosterone. It's actually baldness is a symptom or a sign of adequate testosterone. When male hormone is high, they have more hair in the chest, abdomen, thighs, everywhere, but less hair in the scalp. Right. That is why to prevent that male pattern baldness, now one drug is approved that is known as finasteride 1 milligram. Finasteride 5 milligram was approved for prostrate. Now finasteride 1 milligram is there for androgenic alopecia. That's what all the film stars do after transplant. Once they come here, Dubai or Turkey or Kerala for transplant, after that they use that. Actually, they should use that from the age of 20 years to prevent that baldness. Once your hair is getting thinned down, that stage you use finasteride 1 milligram, your thin hair becomes sharp like anything. So that finasteride was there in India only and America. Now it is approved in UAE also. That trade name is known as Propecia 1 milligram. Okay. That's why guys with falling hairs, don't go for transplant. Take a Propecia 1 milligram, look for 1 year, 80% of hair grows back. But whatever hair that is gone is gone. Whatever falling hairs will become more thicker. Okay. So whenever you have baldness, don't go for all the oil, everything. Go for any conservative method. Females always understand they can also have a male pattern baldness if they have excessive male hormone. Right. So whenever you have baldness, think of 4 things. Dandruff, okay, treat the dandruff. Suppose you have male pattern baldness where your hair is receding, right from the age of 20 years, take that 1 milligram of finasteride, which in India cost you 5 rupees. Here it is covered by insurance also. 1 milligram and prevent the baldness. Your hair loss is short, but maintained hair can be maintained like anything. Right. Number 3 is diffuse hair loss. Some guys, ladies especially come and doctor, after pregnancy my hair is falling down. Doctor, after my 20 years after marriage hair is falling down. Then you check the thyroid, you check the calcium, vitamin D and iron level. But the most common cause of baldness, men, is androgenic alopecia. Female, it can be hormonal, thyroid, calcium, vitamin D. So always treat the cause. Never go for a one-shot medicine. Right. Just like previously jaundice. In Malayalam you say ottamuli. What ottamuli? What is the cause of jaundice? Find that. Many people who tell that, even one guy which I saw 2 months back, he was coming visiting visa here. He told that he had a jaundice at the age of 10 years, treated by Vaidyan. Now he's checked for visa, hepatitis C is positive, cancel, going back. So jaundice is just a symptom. It can come and go after 3 weeks. Right. But what's the cause of jaundice? Hepatitis B, C, that should be found.
So you have to find the root
Find
cause.
the root. That's why when you have a hair loss, it can be symptom of thyroid, it can be symptom of calcium, it can be symptom of iron deficiency or any vitamin deficiency, or even stress can cause hair loss. Right. So find the cause and treat that always.
Right. And in terms of growth hormones, we have short stature and or dwarfism, as said. Could you please tell us more about that?
So basically, height is the biggest wealth on earth. For children, when they come with their parents and parents tell that my child is not going weight, I tell them weight is not a part of growth. Many of the girls who are slim get massive amount of weight at the age of 15 or 16 after menses. Many of the ladies who are slim, after 2 deliveries, they gain massive amount of weight. But ultimately, height you will gain till the age of 14 years in a female and 16 years in a male. So basically, how do you calculate how much height that your child will get according to the parent's height? It is always a formula: father's height in centimeter plus mother's height in centimeter divided by 2 plus 6.5 for the male child minus 6.5 for the female child. Suppose my girl child is having an age of 10 years. My height is 175. My wife's height is 150. What is the average height my girl will attain? My height is 175, wife is 150. So 175 plus 150 divided by 2. That is 175 plus 150 is 325 divided by 2, 162.5. So that's the mid-parental height, but I have to minus 6.5. Right. So she should get a height of 162.5 minus 6.5, 156 to 162.5. That's a mid-parental. That's a target range. Okay. Suppose any time she's falling short of that height, 3 years, 4 years, seeing falling short of that height, I should take an endocrinologist and ask the doctor, doctor, my child is not gaining adequate height compared to our height, or I am going to the school doctor, my girl is always standing in the first row in the assembly, whereas other children are going back. So that's an indicator that other children are going, my child is not growing. What do doctors used to do in the past? They tell, don't worry at all, your child will grow later, come back at the age of 15 years, we'll do something that time. Now we know 90% of the bone fuses by 14 years. You come after 14, 15 years, you can't do nothing with the height. That is why whenever your child is short, 5 years, 6 years, 10 years, immediately take to a doctor and ask, doctor, he's short, will he gain height in the future? That is known as a delayed puberty. Some people gain good height during puberty. You have a good height. Some people have growth hormone deficiency. Right. What's the problem? Parents wait nowadays. They wait till 16, 18 years. At the age of 18 years, they come and tell, doctor, my child is not gaining height. I've seen you take growth hormone. Nothing works. Your bone fuses by 14 or 16 years. After your bone fuses, you take growth hormone. There is no height. There is only width. And some people come and what's the problem with not having a good height? Height always gives you confidence. I've told you, your height you can't change. Your weight you can't change. Your color you can't change. Your baldness you can go for transplant. But after 18 years, a guy is coming with a height of 5 feet. His younger brother is having 6 feet. What's the thing? Life lifelong he has the inferiority complex, having a short stature. We have seen some film stars who are coming to me, female and male film stars, even 150 centimeter, they want 5 centimeter more to have a good height. All the heels, they are just that 5 centimeter, they may have crores in their hand or thousands, but you can't do anything. That's why I tell you, short children should be always be addressed in the short stature. For short stature, there's a hormone, that's growth hormone, but growth hormone works in only children. Once you are an adult and your bone has fused, there is nothing to do with short stature and growth hormone. And many times growth hormone is nowadays more used by gymnasiums and other people as a doping agent to build the muscle. That also can go side effect per se.
And doctor, let's come to the topic of thyroid.
Yeah.
Could you please tell us more in depth?
Yeah. Thyroid is a gland in your neck. Thyroid has two disorders. One is a swelling of the thyroid, that is known as a goiter. Second is the hormonal imbalance. Previously, people used to come more with goiters. Now we know we are all taking iodized salt, so goiter has come down. Now blood changes are much more. It is told that 25 years and above, 1 in 10 ladies have thyroid disorder, and 25 years and above, 1 in 100 men also have thyroid disorder. So some people come with weight gain, that is hypothyroidism. Some people come with weight loss, that is hyperthyroidism. So now the international dictum is that every male should check the thyroid function once in 3 years above the age of 35 years. So as a guy above 35 years, you go to any hospital, they have to check the thyroid once in 3 years. And every female, before going for conception, they need to check the thyroid. Because previously you ask anyone you are having thyroid, patient will, doctor, I don't have any difficulty in my neck, why should I check my thyroid? So we have the concept that thyroid is goiter. Now goiter is present in only 1 in 10 people with thyroid, remaining 9 out of 10 are having hormone changes in the blood. So thyroid is a routine checking by TSH, and the cause of thyroid is no longer diet. People even now come and say, doctor, what about salt? What about cabbage, cauliflower, broccoli, turnip, tapioca? Diet has nothing to do with thyroid, because diet has something to do with thyroid in the previous era when we were taking non-iodized salt. Now thyroid disorders are due to antibody. Your father, mother has a thyroid, your sibling has a thyroid, your chance of thyroid disorder is very, very high. But look at females. Females always check the thyroid after 25 with a gynecologist for pregnancy. Men hardly check up thyroid. Day for yesterday also here I found a guy who was coming with his wife and telling wife was seeing for 3 years, 3 years for thyroid, and this guy was coming with his wife and always coming and sitting there. Now day for yesterday the wife brought the guy and telling, doctor, now it is very hot climate, I put on the AC, he's complaining of AC. So he's always chill that Hindi, she's telling he always chillate hai, the AC come karo, AC ka temperature hai karo. She always feel so much heat, she puts at 18, he puts at 28. And thing is that he goes to the bathroom, they are in a single studio apartment, he sits there for 30 minutes, still he doesn't come out. So the symptoms was just cold indolence and constipation. Just gone. He has little bit decreased memory. He is telling she asked to buy something, he doesn't buy and come. And libido, he was having a sexual desire to have performance. Now once in a month also she's telling she sits in the front of TV, sees TV like that in a coma state. So this can be the subtle sense of thyroid function. He checked the thyroid, TSH was 409. Normal TSH should be less than 5, 409. So a guy coming with a TSH of 409 from 5, it should be 409 over 2 to 3 years. He was coming and sitting with his wife for 3 years, but the subtle symptoms came out after 3 years. Cold indolence, constipation. He goes to bathroom, bowel is not working, constipation, decreased libido. Frequency of intercourse has come once from a day to once in a month, and seeing in front of the TV with snoring, sleeping in front of the TV. So that's the charm of hormone. We always check sugar, but sometimes we may not check other hormone. The same is thyroid, but the same is the male hormone testosterone. Because I told you a female picks up her hormone much more. You look at a female's body, she knows her body. Right. Breast coming down, bleeding coming down, hair little bit popping out, hair fall or hungry hair grow. She knows their body. Men many times don't bother. Many men know that they are having some defect in thyroid testosterone. They think that let me check today or day after tomorrow. So thyroid disorders are getting common in men as well as females. Females do screen it, men don't screen it. And hypothyroidism in females, 90% is permanent. Many people come to an endo with the same. They will come and ask us, doctor, how long should I take it? So previously hypothyroidism was due to iodine deficiency. Now it's due to antibody. Once thyroid, 99% is a permanent treatment. To know whether it is permanent or not, the test is known as antibody. And what about goiter? Previously, any people with any swelling, what do people do? In Kerala or here, they used to go to a surgeon. Surgeon will tell, this is goiter. We'll remove it by surgery. Now we know 100 people having a goiter, only 3 out of 100 have a thyroid cancer. Right. Remaining 97% is normal. So whenever you have a goiter, check the blood level of thyroid, get an ultrasound done, go for an FNAC. If the needle biopsy shows cancer, then only do surgery. Otherwise, there is no need of surgery in any thyroid node. You take the medicine and follow up with the ultrasound scan every year. So goiter, why is not universally removed now? Because thyroid is giving you thyroxine. Your sound is controlled by the laryngeal nerve, which goes behind that. And the calcium, I told you, is controlled by the parathyroid. Right. So for a 1 centimeter swelling, you are taking out the gland, means totally you are taking out an organ from the body. So basically thyroid disorders are on a rise, but it's not goiter, it's a blood change in thyroid.
And what about obesity? What does it have to do in relation with this?
Yeah, definitely. Obesity is on a rise. We know India, China. It's the world capital of diabetes and world capital of obesity. Previously, 20 years back, it was US. Now we know obesity is more common in the developing countries, rapidly developing countries compared to developed countries per se. In Kerala, now one study has shown that 30% of school children between 5 to 15 years are thought to be obese. So 90% obesity is due to lack of exercise and imbalance between what you're taking, what you're spending. Suppose I am having my energy requirement of 2000 kilocalorie per day, but I am not exercising at all, sitting and talking, I am taking 2500 calorie. So daily 500 calories added to my diet. So 7500 kilocalories is equal to 1 kilogram of body weight. So 500 calorie per day. So after 15 days I am having 7500 kilocalorie, I gain 1 kilogram of body weight. So slowly it is accretion. So 1 year you may be having 2 kilogram, per year you may be having 2, you may be slowly gaining weight. And people come to us and ask, doctor, my hormones are abnormal, check my hormone. 10 people having obesity, 1 out of 10 only have hormone disorder. It can be thyroid, it can be Cushing or pituitary. Sometimes drugs also can have obesity. And how to treat obesity, it is basically reverse. You cut off your calorie. That is why people go to VLCC diet and tell, doctor, I went for VLCC, I paid 1 lakh, I lost 15 kilograms. What do? It's a forced starvation. Your body requires 2000 calories, they are giving you 500 only by protein diet. Daily you are removing 1500 calories. Right. 5 days you are losing 7500. So you are gaining 1 kilogram in 15 days. VLCC you are losing 1 kilogram in 5 days. You stay there for 30 days, you are losing 6 kilograms. 6 months you are losing 15 kilograms, but you come home again, start eating, not exercise, you regain the lost weight. So it's known as a yo-yo phenomenon. So that's why whenever you lose weight by diet, maintain it by exercise. Diet is the cornerstone of weight loss, but exercise is the cornerstone of maintenance of the lost weight. You lose weight by diet, maintain it by exercise. And you may ask me, what are the tablets or injections for weight loss? This country, you know, the best charm of this country is that you can't write a prescription on and off. India, what's the thing? Why people are getting caught with all the ganja, hashish and all the sedation tablets? Suppose I write a prescription of a sedative, diazepam 10 milligram. There is nothing known as a control. You go to medical shop in Kadavandra, 5 medical shop, you can get 50 tablets. You go to Alua, from 5 medical shop, again 50. So you go in a car throughout to Malappuram, you can get 1000 tablets with the same prescription. Here you enter a tablet in the system, you know he has bought or not. So it's a control system. That is why how do gym people abuse testosterone? Suppose a guy comes to me for a testosterone, I am writing 250 milligram of testosterone once in 3 weeks. He goes to a shop, buys 3, under shop 3. So a gym person may have 200 strips of this thing with a single prescription. You can abuse it. In this country, everything goes by guidelines, so you can go for abuse. Yeah, everything recorded, so you can go for any abuse. That's why I was telling initially also, hormone should never be abused, it should be used. Whatever extra hormone is in the body is causing side effect. Whatever normal hormone is maintaining your metabolic activity.
And in terms of, let's come to the topic of folic acid and uric acid.
Yeah, understand. Uric acid. Uric acid is a byproduct of protein breakdown. So uric acid high in the body is known as gout. Nowadays it's a very big problem because gouty people used to come with joint pain and gouty people used to come with kidney stone. Now uric acid is set up as a risk factor for heart attack and kidney failure. So you go to any person, doctor used to check the uric acid. When uric acid is high, what should you do? Number one, you should lose your weight. That is obesity. If you're hypothyroid, you should treat that. If you're alcoholic, especially wine and beer, that is when in US it is known as Saturday night gout. That is Saturday night gout, you take more alcohol and beer, invariably uric acid goes high. So every uric acid need not take treatment. Number one, you exercise and lose your weight. Number two, you are a hypothyroid, treat that. Number third, you have an alcoholic, especially beer and wine, control that. Number fourth, if you are having non-veg food, reduce that. Suppose a guy is telling, doctor, I am exercising properly, I am a pure vegetarian, I am not taking alcohol at all. Still my uric acid is high, take a tablet for uric acid. That is an adenuric or febuxostat that will control uric acid. But uric acid is no longer treated for kidney stone or a arthritis. Uric acid itself can cause heart attack or a diabetic nephropathy worsening or a hypertension per se. And folic acid, we know, the two vitamins which are foremost important is vitamin B12, vitamin D and probably folic acid. Vitamin D we know, it is got from sunlight. Many people come and even today morning I saw a patient was saying, doctor, I'm morning Jumeirah or some Albersha Cornish I am running, so invariably I will get vitamin D. So people think that vitamin D you get from early morning sunlight. No. Early morning sunlight UVA, that is for psoriasis and vitiligo. Mid-noon sunlight between 11 to 3 is UVB for vitamin D synthesis. That's why in this country we don't ask any person to get sunlight because UVB index is very high in the mid-noon. So vitamin D, you require 18 minutes of sun exposure. That is 18 minutes of sun exposure per day between 11 to 3 o'clock. We don't go in sunlight between 18 minutes and 11 to 3 o'clock. So that is UVB. So you have to take vitamin D supplementation. And what's the role of vitamin D? Vitamin D is good for calcium absorption, insulin secretion from the pancreas, memory, muscle power, even corona. People say that you keep the vitamin D in the preferable range of 40 to 60, you reduce chance of corona by 27%, you reduce the chance of tuberculosis by 50%. So vitamin D is beyond bones per se. And what about vitamin B12? The old tablet of Neuraband which are taking. So B12 is for the nerves. Especially B12 is deficient in people who are vegetarian diet. pure vegans come with total vitamin B12 deficiency because B12 is exclusively got from non-veg food, meat, milk, fish, egg. And B12 deficiency can cause very bad neuropathy, tingling in the feet. It can cause a memory loss. Some people have dementia. Some people go for florid depression. Some people have ataxia, they can't walk. Some people go for anemia. That is why vitamin D, B12 is routinely checked nowadays. And vitamin D is universal. B12 you give in a person with B12 deficiency. Folic acid is more or less got from nothing but fruits and vegetables we take. And folic acid supplementation is usually given in pregnancy because folic acid is required to prevent the fetal heart defects or fetal neural tube defects. So understand, vitamins are important. You get vitamin by a nourished diet or a balanced diet per se, but vitamins which may be deficient in spite of taking a diet, maybe B12, D, folic acid may not be deficient that by diet because you get it from fruits and vegetables, but cooking many times loses the charm of vitamins. Cooking many times your folic acid and B12 level comes down by cooking. That's why many times people say raw vegetables and raw fruits at times is more beneficial.
Okay, well, thank you, doctor, for sharing all these valuable information with us today. Would you like to conclude with any tips or anything as such for our viewers?
Yeah, nothing. I don't give, this is not for tips anything, but basically understand, always understand the word prevention is better than cure. In this world, what's the biggest problem in this world? Google medicine and Google doctor and other things. Previously, 10 years back, you go to a doctor tells something. You bow before the doctor, you go to the medical shop, buy the tablet. Now what happens? You go to a doctor, before that you search 100 times where the doctor is from, what is the specialty, where the doctor has studied, everything good. Once you get a medicine, you search about that. You maybe think that side effects come, side effects doesn't come. Everything has a side effect, even vaccine. What happened? 100 people take it, 99.9 have a benefit. 0.1% may have a fever or 1 in 1,000 may have a side effect, but it has saved the life of thousands and crores of people. Just take a paracetamol or Panadol you take. 1 in 100 you take, 1 in 100 may have an acidity, 99 people are losing the fever. You take insulin, 1% may have low sugar, other you are saving your life. So that is why previously it was faith. You go to a doctor, you have a faith. You go to a priest, even to confess to a Christian priest, you have a faith in him. You go to a policeman, you have a faith. Now that faith is lost because people are totally looking at the gadgets and looking, and many guys, day for us today I had a guy who was a big industrial person coming here telling me, doctor, my memory is totally, I can't remember anything. I don't remember even my phone number. So what's he doing? 3 mobiles in 3 pockets. Every time his phone number also, his phone number he has to remember that. His son's date of birth he has to remember. So his brain he has put in the gadgets. He doesn't have any brain. Previously, you ask a driver to come to your home. He will tell Dr. Kadavandra, he will come there. Now 10 times he will put the Google map because memory chip is gone. It is not the memory loss. You are distracted. You are eating with your children, 10 times phone is coming. You are giving an interview or even going out with your children, 10 times. Your phone is colliding you. That's why nowadays a gadget free interval is required. Many of the VIPs, including the film stars who come and meet me, they tell, doctor, nowadays we wrote pure old Nokia phones because no me too, you too, no disturbance, just a Nokia phone. Night 10 to 10:30 they open the WhatsApp, everything, close that, again Nokia. So peace of mind. You don't need to look at any photo from any person coming from any part of the world. You just require your known numbers and require. So memory is not at all lost. We have a pseudo dementia. We are colliding our brain with multiple information so that you can retain. Many people don't know their own phone number. So ultimately that's the same with hormone. Why I concentrate more on men? Because I've told you earlier, females have a doctor that is known as a gynecologist to check their problem. They have a wonderful phenomenon known as a menstrual cycle or a pregnancy where you check everything. But men don't have anything, and men suffer from heart attack, men suffer from sex hormone problem, thyroid problem, much more. Men suffer from alopecia. None of the females go with full baldness, but so many proud men go with full bald hair because they know that can be prevented by a tablet. They don't do that. So always think prevention is better than cure. Once a doctor with a known degree, with a known knowledge, after checking your blood, gives a medicine, take that for the course. You may have a benefit in 99%, 1% some side effect. Go and clarify with the same doctor. Don't go to another doctor and again take the same medicine in another brand name. So prevention, always prevention, and live a life that is healthy in mind, heart and body. Till you're 70, 80, 90. We heard 2 days back, Mammootty turning to be 70. Why people rejoice that at the age of 70 he's having no catastrophic, living a good body. So 70 or 90 you can live with a good brain, good body you have it. For that you have to struggle, and your medical and physical health should be perfect.
Well, thank you, doctor. That's all for today. Stay tuned and stay safe.